She says almost ready. Oh, there it is. Is that it? Okay, go.
Well, hello and welcome everyone to our back to school virtual panel part 2 discussion. It is sponsored by New United Missionary Baptist Church Health and Wellness Ministry. At this time, I would like to introduce our distinguished group of panelists, Dr. Kevin Johnson in internal medicine, Dr. Angela Smith-Slack, a pediatrician, April Taylor, a licensed professional counselor, Bradley Jackson, Campus Support Specialist for Hamilton County Schools, and Cheryl Fletcher, the Director of Hamilton County School Nurses. Thank you all to our group of panelists for being here. We certainly do appreciate you sharing your time and expertise with us. There are lots of questions from the community and from the public, and we want to get right to those. First, Hamilton County Schools, they've now been in session for about 9 weeks, while regular staff absences can take a toll on the school system. But due to COVID-19, you add that to it. And then these school systems are facing an even bigger challenge. There was just this week a school in Hamilton County where there were nearly 40 staff absences. Now, we don't know exactly how many of those were due to COVID, but I guess I'll start with you, Ms. Fletcher, and talk about how the schools are dealing with this when it comes to maybe staff absences and dealing with people out because of COVID-19 and trying to keep everything together and running smoothly and keep the school system safe and running.
But we work jointly with the health department to do contract tracing, that determines who was in close proximity to who tested positive. A lot of that plays a lot into whether a school was closed for some days for cleaning and how long staff will be out. So we look at that. We immediately, when someone tests positive, we start tracing, who was in the classroom, who the teacher were, who was virtual, who did they have lunch with. And then from there, we interview individuals, we work with health department, and then we determine based on that who has to self-quarantine, who has to be tested, how long they have to quarantine. A lot of that plays into the interview of the individual person, which takes some time. It takes the school nurses, the principal, sometimes the teachers, some of our IT department, we have to pull rosters, and then we refer those people to talk to the health department. Anytime anybody's tested, those test results are sent to them. So we have to work in conjunction with them. So it takes a big team of people to determine, what to do if a school has to close, if we have enough staff or enough substitutes to come in to fill those positions. A lot of that, and sometimes it's up until late in the afternoon or at night before we can decide, do we have enough to cover to keep the building open?
Now, we've seen a number of schools have to close on more than one occasion, in some cases this year so far. Well, let's talk about one of the things that they've done is they've hired a team of nothing but people who specialize in this cleaning to try to keep this, because that is so important right now, that these schools are kept sterile and kept clean. If you can kind of address that and tell us how that works, because we know that if a school has to be closed down, it's closed for a minimum of 2 days, correct? And then tell us about that cleaning and how that works.
Well, what they do, they go in and they wipe down, in addition to doing the standard cleaning, the mopping, the sweeping, the dumping of garbage, they do a wipe down. They wipe down doorknobs, disinfect rather, doorknobs, desktops, any touchable surfaces, handles, glass, partitions in the bathroom, sinks, countertops, desktops, and this goes on throughout the school day as well. So when we close a school, that is even in addition to those type of cleanings, then they do fogging. And I forgot the name of the disinfectant that they use, but it's equivalent to, I forgot, can't think of it right now. But, they fog the room in addition to the regular cleaning. So that helps kill the germs, gives it time to settle and kill the germs. But one thing that I try to make a point when I'm talking about the cleaning is, remember, this is an airborne disease. It will live off surfaces for a short period of time, but it needs a host to survive, and that's a human person. This is a person-to-person airborne disease. So cleaning is an important factor, but wearing those masks, staying home when you're sick, covering your mouth when you cough and sneeze, those are the most important things that you can do to keep COVID-19 from spreading.
And you bring me right to my next point. Thank you for that transition, because just this week, Hamilton County Mayor Jim Coppinger extended that mask mandate. So I want to go to our medical professionals right now and talk about the importance of when it comes to wearing those masks. And I'll start with, first of all, when we start talking about small children, Dr. Slack, do you find it hard, or do you find most of your parents and your patients realize the importance that their children wear those masks?
Yes, and thank you for having me this evening. But yes, we see in our practice where most of our patients and their children will wear masks. You know, the recommendation is if you're over 12 really to wear masks, but then some sites even say a child that's 3 years old, 4 years old should be able to wear a mask. We don't really think that children under 2 will wear that mask all day long. You know, however, if you're 3 or more years old, we feel that you should be able to wear a mask. And we're finding in our office that parents are adhering to it. There are many days where a mom might say, put that mask back up, put that mask back up. And the child is so accustomed to it that they put it right back on. So yes, we are definitely seeing that the parents are doing their best to adhere to wearing the mask in the office, because at our office, you have to wear a mask in order to be seen. And so they realize that that's very important to reduce transmission, because if we can reduce transmission, hopefully we can reduce infection, which will reduce sickness, which will reduce death. So, you know, so they protect themselves and they protect us, and we in turn do the same by wearing our masks. So
Setting that example. Dr. Johnson, let me turn to you. One of the things I've heard from some other medical professionals in our community is talking about the concern that some people are becoming complacent because they showed, the health department showed a chart this week where they said the numbers are we haven't, like, we're not where exactly obviously we need to be, but we are doing better. And, you know, you're having people, like, even now, sometimes in restaurants where servers, we're doing stories about this. People are giving them a hard time when these servers say, please put on your mask. And they go in a business and these employees ask them to please put on your mask. What are your thoughts when it comes to, or concerns when it comes to people becoming complacent? Because some areas of this country are seeing spikes right now. There are quite a few states, if you look at the map, that are seeing spikes in COVID-19 cases. So what are your concerns about that?
You know, I'm going to echo what Ms. Fletcher said earlier. COVID is a respiratory virus. The mask is probably the most important component to treating such a disease. And now we're in the season of influenza coming up, another respiratory disease. So there's double reasons for wearing the mask. And let me just say this, you are so accurate, and I'll give you a few numbers. It is estimated now that 50% of people are wearing their masks, 50%. We could almost eliminate the corona in one season if we could get that up. And this is Dr. Fauci's recommendation, that we could get mask wearing up to 90%, 85%. We could suppress this virus and really make a big elimination, especially when you can put the mask wearing with social distancing and hand washing. But I'm just going to conclude by saying there's no excuse for not wearing the mask, especially with influenza season coming on top of COVID season. I know we'll see a little something about that later.
Yeah, we're going to talk about that. What's being called a twindemic.
That's right.
Right, coming this fall, and we certainly will jump back into that. I want to kind of jump around a little bit, and Mr. Jackson, talk about, we have learned that, you know, we've seen some football teams have to cancel games here or there this year already, early into the season. Just learned that today another team, local Hamilton County team, is quarantining. Talk about the impact that this is having in trying to keep teams and athletes safe. so that they can get through the season and obviously not spread this throughout the team or spread it to others?
Yes, ma'am. That's a great question. And that's one of the things that we have been dealing with, not just here in Hamilton County, but across the state and across the country. We have implemented so many different policies and procedures to try to keep all of our athletes safe. We follow at the very beginning of this, when we started athletic practices back on June 1st, we followed the National Federation of High School guidelines. Dr. Robertson and I talked, and we implemented different phases. And when the governor came out and said that contact sports could take place, we still relied on the National Federation of High Schools and the Hamilton County Health Department to try to ensure that we were following every guideline that we knew that could possibly help our athletes. I actually sent out an email to our athletic directors, and I'd asked the health department about a week or two ago how much this virus was maybe passing down from athlete to athlete or coach to athlete, however you want to think about it. I cannot think of one case so far that we've had a spread of the virus within a team due to close contact. There might be one or two, but I asked that to all of our athletic directors at 34 of our schools, and no one got back with me stating that the virus has been passed in that way. What we are seeing is that athletes are being exposed to the virus from outside of the practice areas, whether it be siblings, parents, or doing whatever. But what we have done, it seems like it's working. Our high schools, our high school athletic teams, we have a contract with Erlanger Hospital, their trainers, and they provide, they take temperatures every day of our athletes and coaches. They ask questions every day, you know, if you had a cough, if you had this. And so we have been very diligent. The trainers and the coaches have been very good at trying to keep this to a minimum. Like you said, that was confirmed to me just a little while ago that there was another high school. I do not know the facts about this particular case, but it would seem as though the other cases that it came into the team from outside. So once again, I'd like to thank Erlanger. They took a big financial hit last year, our trainers, because we, got done with school early. And Dr. Jackson, the CEO of Erlanger, decided to keep our trainers intact this year because it was a contract year. And so they took a big financial hit, but we have told every one of them how happy we are that they did this. They took a big financial hit, but our athletes needed this for this year especially. So that's what we're trying to do. Now, once again, you can do everything you can possibly can, and we still have this. But we feel that the athletes are needing this. There's a couple of studies that have been out, University of Wisconsin, that 12 times athletes are more likely to have mental issues since athletics is not taking place. Dr. Bruce from Erlanger gave me a CDC report that, we're about 2 times more likely to have our athletes to have suicidal tendencies or other mental health issues. That has just came out from the CDC. So we understand how deadly this virus can be, but we also try to manage how important it is to these kids to be back out from the mental aspect.
That is so important when we start talking about, and that leads right into a great question I have for Ms. Taylor, that when you start talking about the mental aspect of this, and my question was going to be about the students, the teachers as well, but he brought that on about how important for some of these kids, sports, this is really sometimes all they have to really look forward to a lot of times. This is their outlet that makes them feel special, that gives them self-worth and self-esteem. So, Ms. Taylor, talk about this, the impact of this on, as Mr. Jackson was talking about, the mental health aspect. You see, to talk about suicides and different things, and whether it's athletes or students or teachers.
Absolutely. That was a good transition. I was listening as he was giving those stats. One of the things about sports, as well as any movement, exercise, they're all good for your mental health. So when we take that away, it's going to impact our mental health. Isolation. We've all been isolated since March. I call it the perfect storm. We've had so many things happen right in a row, right back to back. 210,000 people died. We've had the racism stuff. We've had so many different things all happening, all the protesters, and then the kids not being able to go to school, not being able to see their friends. That impacts kids and it impacts adults too. A lot of adults are also impacted. We've got parents working a full-time job, coming home and trying to manage and help kids in school. We've got teachers not used to the Zoom and not used to the technology. So they're trying to learn the new technology, do their work, deal with the parents, deal with the teachers, deal with the IT stuff. It's a lot. So with mental health, we love to teach coping skills, helping people understand movement, the importance of eating, the importance of sleep. Sleep is so important. But back to the athletes, the reason it impacts them so much is because it's like you said, their outlet, the thing they do for their mental health, the thing they do to feel better. And then we take that away, they feel like they don't have anything. And I'd like to remind everybody that the outside hasn't really been taken away, so we can still get out, we can walk, we can get fresh air, we can bike, we can hike. I've started to learn to start hiking and biking and doing some things myself that I wasn't doing outside. But so the outside really is not been taken away. We have to be safe. We have to social distance. We have to mask up, but we can be outside. So it's, again, I use the word the perfect storm, and it's impacting our kids, the littles. And I love to remind people that technology is here to help us. A lot of people, because you work on it all day, they kind of stay away from it. But technology can also be our friend. We can do a lot of social events and help kids have play dates on technology. There are a lot of things we can use to make it a positive thing. So we need to try to figure out how to use it to our advantage.
And one of the things I want to jump back to, Mr. Jackson, you talked about, and you were talking about, you just got confirmation about this particular school and the team quarantining that I asked you about. But one of the things too is that it really is, when you talked about it coming from the outside, where these kids are going, they're in homes with, other siblings, with parents, with grandparents, and maybe some people are wearing masks, maybe some people are not. And unlike we were talking about in sports, unlike the NBA where they lived in a bubble, it's almost like because you can't that's impossible to do for our Hamilton County school athletes to keep them in that bubble, that it's almost impossible and unrealistic to think that there's not going to be a case or two that makes its way to these teams.
Yes, ma'am. Our coaches have told all their players and athletes how important it is, like Dr. Johnson was saying, how to wash their hands and wearing masks, and just to be proactive in all kind of hygiene. And so those things, it seems like it has been working. But I did want to add another component to this. Is a lot of our athletes, this is their gateway to college. And so if they're not competing, it could impact their families and themselves for their whole lives. And so a lot of our lower economics students, they depend on these athletic scholarships to get them in a direction that will provide for them and their families for the rest of their life. So there are so many things that are so important in athletics and building that community and that camaraderie. And we are trying to keep it going. But like I've told all our athletic directors, tell your coaches that this game that you played, this last game, act like it's your last game, because you don't know when your next game's going to be. And just be happy that we are able to compete this year and to make some kind of normalcy with this year, as crazy as it's been.
And it really has. And you're right, there is no understating the fact that, like you said, for some kids, athletics, it's their future, it's their way out. And so that's so true. Something I want to jump back to now, and Dr. Johnson, we mentioned this, and I'll get you and Dr. Slack to talk about this twindemic that our national CDC and medical experts have been talking about when COVID and flu season hit, and how it can possibly overwhelm our healthcare system. I had talked to some local medical experts about when this was at its peak this summer and how our healthcare system was just overwhelmed in so many ways. Talk about that and what we could be looking at if our children and if adults do not get those flu shots. And I'll let you start on this, Dr. Johnson.
Yes. Again, the issue is COVID-19 is a respiratory virus. Influenza is a respiratory virus. As it turns out, COVID, we never peaked. I mean, once we rose, we continued at a high level. So COVID is here, and it's going to be here for another couple of months. Now the flu season, and here's the other difficult situation. Not only are we talking about two respiratory viruses, they have the same initial symptoms of fatigue, fever, cough. So you see, you can get them confused now. You can have an influenza patient going to the emergency room thinking he has COVID. You can have a COVID patient staying home thinking it's influenza. So here's the point I'm making. It is so important, and I know Dr. Slack is going to speak about this in a minute as well. It is so important to get the influenza shot now and reduce your chance of getting influenza. COVID is enough of a problem. You don't need to add another respiratory virus on top of it. So, and I'm proud of New United on the 17th of this month. New United will be giving influenza shots, along with lots of other places you can go. But again, there's no excuse for the general public not to get their influenza shot. I'll just close and turn it over to Dr. Slack by saying, you don't want two respiratory viruses at one time. COVID is deadly. We know that now. I don't have to convince anyone. You don't want influenza on top of COVID. It's just unfathomable. We can't think how terrible that can be.
Right.
Dr. Slack?
Right. I agree. You know, the twin-demic can be a major burden on the healthcare system. It is going to be a major in decision-making for the primary care physician like myself and Dr. Johnson. When we see a patient, is it COVID? Is it flu? We really won't have a way to tell because the symptoms are very, very similar. You're talking about fever, you're talking about cough, you're talking about body aches and fatigue. That could be either of the two. You know, the beauty is that now we do have increased ability to test, for COVID, which will help us in that decision making, but not all offices will do that. You might go to the emergency room, you have to wait for hours, so it can be a major cost burden, on the healthcare system as well. Even though COVID doesn't seem to affect the young children as much as adults, less than like 7% of COVID cases are coming from school age children. And even when you talk about, like deaths, less than 0.1%, but nevertheless, in pediatrics, flu season is a very, very busy season for us, even taking COVID out of the equation. So we're already trying to gear our minds, for the burden of, like our staff and even on ourselves. I mean, we have given our lives to help others, and we are honored, that the Lord has graced us to do that. But it can be a mental and physical burden on the caregiver, as well. So this twin-demic has the potential to be an awful, awful burden from every aspect, from that first symptom all the way to healing. So I agree with Dr. Johnson.
Big concern. And let me just ask both of you all quickly. I had spoken with a local infectious disease specialist here, and my understanding is that it's not here in Chattanooga yet, but there is a test available that they're hoping to get in Chattanooga soon, where you can tell the difference between it tests for specifically, is this COVID or is this the flu? Any news about maybe if that will be available in Chattanooga this fall or before the winter season?
Yeah, I'm almost certain it will be. And we have tests right now that are discriminate. We have tests that are discriminate, but they're not available to everyone. That's the only point I'm making. Yes, you can discriminate between the two, but can we do it for 100% of Hamilton County? And a little costly for that or so there. So the better thing, the cheaper thing, and the better thing is get that flu vaccination, and you can almost eliminate the flu. And if you get sick, you can almost assume you may be having COVID symptoms.
Right. I do want to piggyback on that. Yes, there are some companies that actually have a test that will help you differentiate whether it's COVID or the flu. But it takes weeks for that to be released to your office from the government. We at our office for weeks and weeks, and I mean like going into months, have been trying to get approved to even run the test, and we would get our hands slapped for different reasons, or the government at one point pulled all the rapid tests and said that no, we're going to give them only to hospitals and nursing homes. But we were like, we're the primary care people. We're the ones where the mothers are calling saying this is what's going on, and they wanted a decision as to whether they could go back to work, send their child back to daycare, but it took us months to be able to be approved for that. And we just launched at our office on the 28th of September to be able to do that. But that is not without a lot of headache, heartache, praying, crying, and, all of that combined. So there are some companies that will release that to some of the primary care physicians, but it's difficult to get that. I want to also go back to the flu vaccine, because in pediatrics, we recommend the flu vaccine starting at 6 months of age. So it is very important to do that. Lots of offices are having flu clinics, and I'm excited to hear that New United is also having a flu clinic on the 17th, because it is so important to vaccinate, the children as well as adults when it comes to that flu vaccine, because hopefully that will take one of those decision-making tools out of the equation when flu season really peaks.
Yeah, that is so important. Thank you so much. And I want to turn to you now, Ms. Fletcher, and talking about, the schools braced as we had this first discussion before school started about what to expect this school year. And we've been at it now, like I said, about 9 weeks. And one of the things that I'm noticing is that we are reporting a lot more on, we had talked about, I remember our discussion, was the elementary schools. And we talked about how hard it would be to get those young kids to keep those masks on. But the schools that we've been reporting on, as like I talked to Mr. Jackson about today, that we're having to close down sometimes 3 times for some schools more, are our high schools. Talk about that and what's going on. Is it because our teenagers just think that they're invincible, think it can't happen to them? What's going on with that we're seeing more of this with our older kids?
What we suspect, early on is that COVID-19 looks like an adult disease. We think the children may be carriers, or they have it, and they sometimes don't show symptoms. There's no fever. They're running around the classroom. They're fine, and they may have COVID. The impact is on the older people, the adults. You have to play into factors their age, any other health conditions, BMI, a whole lot of factors. But we've noticed that it is more of an adult type disease. So it's not a surprise to see it impacting our middle schools and mainly our high schools. And also that is a population that's hard, in addition to it being an adult disease. Most of our transmissions at school, our quarantines, are because they've caught it from somewhere else. It's usually not transmitted in school. Most of ours, even with our staff, it is somewhere they've been outside and they start feeling bad, and then they self-report, and then we have to quarantine them. Then they test and they test positive. But most of that is done outside. And what we end up having to do is trace back to when they were last at work or in the classroom and who were they around. And then that's how we decide if we just send home the kids in that classroom, or do we close the whole school? Is it a team that they were on? And this population is very mobile. Most of our elementary kids, they are with parents or guardians or sitters or after school. They are really in guarded places overseen by adults. Our high school people, those are athletes. They travel, they have licenses, they drive, they work outside of school, they have multiple things that they do. So they will wear a mask in school, and then you may see them gathering, playing a football game with friends. Nobody has a mask on. And that's usually the scenario. Even with our employees, the same thing. The transmission usually doesn't occur at school. It's usually someplace they've been outside the work setting that causes that. So it's a twofold answer. Yes, they are more mobile, and we cannot make them do what we can make younger kids do, wearing those masks. And it's just it was something that we hoped didn't happen, but we see, yeah, it's going to be that way. You just can't control that group. They are adults, so
So they think, right?
right?
And
Exactly.
yes, exactly. So, Mr. Jackson, going back to you, one of the things that Ms. Fletcher was talking about with and she mentioned like athletes that they're being more mobile, and you'll see people, and we have our crews out, and we're covering Friday night football a little differently this year. We're staying back. Our photographers are staying back. They're not getting close. But again, you are also. Do you find that coaches and teams and your fans are cooperating when it comes to wearing masks when they come to these games, trying to practice social distancing, or are you finding that to be a challenge?
Yes, ma'am. It is a challenge. We have reemphasized, and we right when we started the high school seasons, athletic seasons, there was some discrepancies that we needed to straighten up. To give you an example, volleyball. The girls, one team all had their mask on the sidelines, while another team did not. And so we wanted to ensure that they're not going to wear masks when they're physically out there competing. That would hamper them too much, and that would cause more issues than probably even COVID. I hate to say it like that, but what we try to do is to reinforce that they mask when they come off the playing field, with the exception of football. All the other athletes, when they get done and they get their body rested because they're on the bench or they're taking a break, that they wear a mask. If they, right when they come off the court though, or whatever, that we have instructed, or I've instructed our athletic directors to put them away from the team until they catch their breath. And when they catch their breath, they can put the mask back on. I hope that is taking place everywhere, but I also understand that people sometimes do what they want to do. I actually had a phone call this evening at a soccer match, and some parents were not wearing masks in the stands. And so we've actually had to cancel a soccer match, a high school soccer match this year, because the parents refused. So the principal went out there and kept warning them, and they decided they weren't going to do it. And so he just stopped the match. So we don't want to go to those extremes. But like, I had to call this parent back because she called the district office and just went over it with her, why we're doing it, that it's a TSSAA. We're a member organization, or a county of this organization, and we have to follow their guidelines, and their guidelines are pretty stringent. And then we piggyback off our health department too. So when I got off the phone with her, it seemed like everything was better, but you can still tell that it is a challenge to keep their mask up and everything else. But the concern when it gets into the winter sports is everybody's going to be inside. And so the outside piece is a little bit better to handle because there's more room, there's more space. But once you started getting into gymnasiums and other things during basketball, wrestling, other type of things, we're going to start running into some issues. And so we've instructed the athletic directors and administrators, if parents keep refusing, that we'll have to escort them out and to make them leave. And we don't want to do that. These kids and coaches have worked too hard to try to make it right. Then parents coming in, or some whatever spectator, and not following the guidelines that we've got posted everywhere. The district posted signs at all of our gymnasiums and athletic venues, with the TSSAA sent out, just saying, hey, these are for the kids, respect your neighbor, respect everybody, wear your mask. And so once again, we're trying, but it's a tough challenge.
Anytime you're dealing with people, Dr. Johnson, I just want to turn to you because I'm listening to this and I'm thinking what Mr. Jackson is telling me about these parents. And first of all, you're setting a horrible example for your child. But you want to just say, when we get back to, of course, I was talking to you about the mask and the mandate, it's the rules, it's a mandate, it's common sense, and it's out of respect for other people as well as yourself during this healthcare crisis. Are you surprised by the kind of the blowback, so to speak, and the stances people are taking about wearing a mask?
I'm very surprised. I'm very surprised. And let me give you an example of the effectiveness of the mask. This is just one liner, but I want to show you how effective the mask is. Canada is just right across the border. That's the next country to us. The US right now, we were up to 2,000 deaths a day. We down to 1,000 right now, a little bit less than 1,000 deaths a day in the US. Canada can have anywhere from 0 to 9 deaths a day. 0 to 9 deaths a day. What's the difference between Canada and the US, and we're so close? It's only that they follow the mandates, the masks and the hand washing and the social distancing. So yes, I am surprised we don't do this. This is unnecessary, what we're putting ourselves through. It is unnecessary.
All right, and Ms. Saylor, let me go to you as we start to kind of wrap up this here. One of the things too, as we get into this fall season, and like you said, we've already been talking about how people are dealing with depression, with mental health issues. And this is already the time of year where some people deal with what's called SAD, seasonal affective disorders, at this time of the year. Couple that with the pandemic and what we're seeing, talk about how to deal with that as it gets darker. You're keeping kids in more, they're already not seeing their friends, teachers are stressed out. I just spoke to one of my friends earlier today who says that she is just so overwhelmed with trying to her demanding job and trying to teach her kids virtually, online, and her other obligations, and it's just a lot. She said, Latrice, I'm just overwhelmed. Talk about a little bit about that.
So I'm glad you mentioned SAD, and I want to piggyback on suicide too. I don't want to just, like, I had an opportunity to talk about suicide, so let me do that first, and I'll come back to SAD. We always need to pay attention to suicide numbers. We need to pay attention to them in our community, in our schools. It's preventable. We can look out for each other. We can help people get help. We can reach out and ask people how they're doing, lean in. Like we never want to take that for granted. We always want to try to lean in and find out. So as a people, we can all help our kids, help our adults. And that brings me back to the overwhelm. So when we're overwhelmed, that's a part of anxiety. So we need to learn how to deal with the anxiety. The anxiety is worry. We're having fear. We're overwhelmed. There's too much going on. Sometimes it looks like panic attack. Sometimes it looks like just breathing hard, nervousness, sweating. There are a lot of side effects to anxiety. So we want to pay attention to those things. We want to pay attention to depression. Sometimes we're sleeping too much, we're sleeping too little. Sometimes we're eating too much, we're eating too little. There are a lot of symptoms that we can have. And when we have those symptoms, our thoughts are racing. That's one of those anxiety symptoms. Our thoughts are racing. But we can address all of those. And let's go back to SAD. SAD is seasonal affective disorder, as you said, Ms. Latrice. And this year, it's really come in because of so many different things going on at the same time. When the fall came in, I think a lot of people got hit with seasonal. We're stuck in the house. So we've been kind of stuck in since March. Travel is something that we all did for self-care. We at least learned that we can go somewhere, get on a cruise, that's been taken away. Sports, all the things we love, sports, movies, theater, taken away. So now we're down to just bare things. So I tell people to be creative. enjoy nature. There's a lot of things outside that we can enjoy and do. Do what's fun to you. I like biking, so get out and bike. Music hasn't been taken away. Again, outside isn't taken away. So be creative. Also just think about the things you enjoy. Self-care is just so important in this season. And that's going to help us with all the mental health diagnoses that we talked about. It's going to help with anxiety. It's going to help with depression. And I didn't talk about grief and loss, but with 210,000 people dead from this virus alone, have mercy. That's a lot of people. And so it's like, as a nation, we're grieving. And so and we have to address that grief and loss as well.
Okay. And one of the things too, and I want to kind of, as we wrap up, Ms. Fletcher, I want to go to you because it's so important. I was told that some of the comments that we're getting is talking about kids needing what mental health help is also available in the Hamilton County school system for students, for staff right now.
Yes, well, we do have some organizations that are working in some of our schools, Cornerstone. Then we have counselors. We have counselors in every one of our schools. So most of the high schools have more than one counselors, and they have programs that they work with the students with. And then also, of course, each school has a school nurse, and we have a team of people that can help. But what it takes, it has this: the family, the parents have to let us know. Sometimes that child won't say anything. Sometimes that adult won't say anything. So you have to understand that sometimes you have to talk for them. If the child is acting a little different, withdrawn, or acting out, that is an indication that something is going wrong. The same with adults. If they're sick, they start to have different symptoms, like headaches, they're tired all the time, they're not eating, they're not sleeping. Those are symptoms of underlying mental health things. And we just ask that they reach out or talk to someone, and that someone gets some help, point them in the right direction to get some help.
And the other question, Ms. Fletcher, is: are you all prepared with us going into the school system flu and COVID season to be able to tackle these two giant healthcare issues and crises?
Yes, this year Hamilton County bought flu vaccine for all Hamilton County employees, and it's free. And they are going to different clinics, different sites throughout the district. And then again, we have 3 clinics that they've opened up with the one-to-one health. If they miss some of those are drive-through clinics. If they miss those, they can make appointments to go to those one-to-one clinics free of charge to get their flu vaccine. And then we're encouraging our parents, please get your child vaccinated, flu vaccine, and keep the regular immunizations on task as well. Because of the pandemic and some of the offices had to close, some of the kids are behind on their regular immunizations as well. So we're encouraging parents during all these breaks we have. They're out of school tomorrow all the way through next Tuesday, and then they'll have a week off for Thanksgiving break. During those breaks, please contact your healthcare provider and get those vaccines as soon as possible.
Okay, I would like to now give everyone a minute for a closing statement, what you would like to leave people with as far as when it comes to our school system, our children, and just keeping our community safe. Dr. Johnson, I'll start with you.
Just that I really appreciate everyone on the panel and sharing the information. That's what we need right now to bring that frequency of mask wearing up, education. That's all people need, more and more education. That's all I want to say.
Okay, Mr. Jackson.
I just would like to tell everybody to keep moving forward. This has been a tough time, but to respect everyone and wear your mask. That will help protect not just COVID, but also the flu, and to support your teachers and your medical personnel, because everybody's been through a lot. So we're going to get through this together, and when we get done, we're all going to be a better people about it. I hope so.
Thank you. Okay, Dr. Slack.
Hi, again, thank you for having me this evening. I would just like to basically piggyback on what they're saying. You know, we have to protect each other. You protect me, I protect you. The best way to do that is with the mask. So mask, hand washing, social distancing, teaching your children the birthday song so they can wash their hands for 20 seconds, and, and just keeping a smile on your face and taking care of yourself.
Okay, Ms. Taylor.
So my takeaway would be there is hope and help available. We have mental health services. We work with the school system as well. So we kind of go into any of the school systems. So Sound Living is here to help, to serve. We work with parents, we work with children, we work with adults. We have up to 8 counselors now. So we're growing. The pandemic has grown us. So there's a lot of pain and suffering out there, but we're here to serve. So that would be my takeaway.
Okay, and Ms. Fletcher.
This is a community problem. We are all in this together. Just piggyback on what everybody said. Wear your mask, social distance, wash your hands, respect one another, and we'll get through this together.
All right. Well, our pastor, Dr. Jeffrey T. Wilson, was not able to join us this evening, but on behalf of our pastor, our first lady, I would like to thank you for joining us this evening, and thank you so much to our great panelists for sharing your expertise and your time, because this is something important, as we talked about, continuing to educate the community. And when we educate the community, we empower the community, and we can get through this. And again, I would like to say just thank you so much. And then also thank you to the New United Health and Wellness Ministry, Miss Joanne, Miss Gwen, Miss Janiqua, all those behind the scenes. Thank you so very much. We certainly do appreciate all your hard work that you are putting in. And again, to everyone, this will be online, that you can go and you can see this. So you can feel free to please share this with your friends, share this with your family members. This will be online. Also, I think it was mentioned a couple of times, but November the 17th, flu shots will be available at New United as well. And they were talking about that because anything we can do to help prevent any confusion with COVID-19 and cut down on the flu will be so important this fall. Again, thank you to everyone. Have a good evening. Thank you.
Thank you.
Thank you.